Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and we're here in Detroit, actually in Corktown, one of the neighborhoods in Detroit, and with Chris Lake. He's our medical assistant that works with us. And we had a ton of questions. We had a ton of frequently asked questions, so we're going to do our top 10 most frequently asked questions, maybe 11 or 12 because we get a lot of them. So Chris is going to kick it off here. What do we got?
So our first question is, do we take health insurance?
Yeah, unfortunately, we don't bill or use insurance. We use health insurance as a financial tool to protect you from bankruptcy. So basically, you should have some sort of insurance coverage that you're comfortable with. However, what we provide at our office at Plum Health is we provide health care. And we really get to know our patients and really give them excellent health care. It means we meet people at the door. We spend an hour with people for their first appointments. I answer my phone calls when my patients call me. And we really deliver a really high level of care. So that's our focus, and that's why we don't bill or use health insurance.
Awesome. So the second question is, should a person cancel their health insurance?
That's a great question. I mean, that's a tough one to say you should cancel once you start with us. I don't recommend that. I think you should have some sort of health insurance that you're comfortable with, and then use us for your primary care services. We can take care of about 80 to 90% of the primary care services that you might need. And then I've had people who've been with us for like 6 months or a year, and they love our service, and they want to keep us for a long term, and then they back down on their insurance coverage. Maybe they have like a platinum plan, and they go down to a silver or a bronze plan or something like that. And that's how you can save money in the long term, by pairing excellent health care with a health insurance product that works with that.
Awesome. So that ties into our next question. How much does Plum Health cost? Is it affordable?
Yeah, we get that a lot. So people are paying cash or with a credit card every month to be a part of our service. It starts at $10 a month for kids, so children under 18, $10 a month. Once you turn 18, it's $40 a month, and once you turn 40, it's $69 a month. And then for folks over 65, it's $89 a month. So this is a membership model, and we do a group discount if you have 5 or more employees as a part of a small business. We do everything for $49 a month. So that's a part of our plan as well. So we do have small businesses that we care for in the community. We mostly see a lot of individuals and families.
Awesome. How do I sign up, or how does one sign up for Plum Health?
Sure. If you love technology, you're good at using computers and comfortable putting your information in online, you can sign up on our website, plumhealthdpc.com/schedule, and you can enroll online. So that's a pretty easy way to enroll. You can navigate to that from our main page. It really takes about 3 minutes to sign up. But if you would rather do it in person, or you aren't able to use a computer as well, you're welcome to come in. We're right on Michigan Avenue, so you can walk in the front door. You can talk to Chris, and Chris can help you get signed up, get enrolled. That, again, takes like about 10, 15 minutes in person.
So what are the age ranges? Like, how old are most of your patients?
Yeah, so our patients in our practice, it's a big age range. So our oldest patient is 101 years old, and our youngest patient is 6 months. So a lot of families are part of our practice, a lot of young families. So we often see newborns coming in their first week, second week, third week of life, and doing all the routine health care for the kids. And then taking care of mostly young adults. Mostly, we're seeing folks who are 30 to 60 years of age. And then we do take care of maybe 20 plus folks over the age of 65. But, mostly young to middle-aged folks. But it's a very wide range. We're family doctors, family medicine doctors. So we're not pediatricians, which see kids under 18. Mm-hmm. We're not internists who see adults only 18 years and older.
Right.
We're family doctors. We see both. We're trained to take care of the scope of the family.
Awesome.
Yeah.
Can a person come to us to get their blood drawn?
Yeah, and that's really easy. When you're a member of our practice, you can come in and have your blood drawn in our office anytime you need it. We usually do annual lab work. We check like a complete blood count, a lipid panel, thyroid studies. We do a comprehensive metabolic panel checking the kidney function, liver function, electrolytes, and we do a test for diabetes called the hemoglobin A1C. All those tests I just named, 5 tests, $31. They're about $5.50, $6 a piece
Awesome.
for those 5 tests. That's what we're doing the most of. But some people come in every 3 months to check their hemoglobin A1C because they have diabetes and they want to know their numbers.
Right.
So, or we have folks who come in for STD testing is another big one. We take care of a lot of young people, so STDs come up. So we do chlamydia and gonorrhea is $23, HIV testing is $10, and testing for syphilis is $4, and then herpes, HSV1 and 2 together is $17.
So basically around the same price, $30.
Yeah, for all those tests I just named for STDs, that's about $50, $57.
Okay.
Yep.
And do you have a brochure? Do we have brochures to pass out, or
Yeah.
something that person can print out?
Yeah, we have brochures. We have I think we have our brochure online, and we also have listed all of our lab and medication prices are listed online. Not all. It's like your 20 most common medications and our 40 most common labs are on our website. If you just go to our main page under pricing, there's a section that says click here to find our meds.
So for the patients who have trouble leaving the house, do we make house calls? Are you able to?
Yeah, so we do make house calls as a part of our service, and we do charge extra for that. It's $100 per house call, and that just allows us to take the time we need to go out there, drive out there to the house, and then take care of people adequately, and give them the time that they need.
I'm going to throw in a question. Does the $100 include the blood work or everything that's going to be done during the house call, or is that just for the house call?
It's doesn't include anything other than us just making the house call, and then any additional services are a la carte on top of that.
Awesome. Parking. That's a big concern for most people. Do we have free parking? Do we have?
Yeah. So right now we do, which is awesome. We just moved into this new space, 1620 Michigan Avenue. We're on Michigan Avenue at the corner of Michigan and Trumbull. So, we're at the old Tiger Stadium site. We're on that site, and they built a new 4-story building. We're on the first floor. Looking out of our window, you can see Bucharest Grill and this place called Eaton Springs. And we're right there. So there's free parking on the street until it gets metered.
Mm-hmm.
So, people ask, is there a place to park? Well, yes, right now it's free. There's usually a few spots out there that you can come park. Our patients, so far in this transition from our old office to this new office, haven't had an issue. But, eventually it will be metered, and it's probably going to be like $1 an hour once it's metered, and we can help people navigate that if you need help with it.
Awesome. So I'm going to throw in one more question because it just popped into my head.
Sure.
Wait time.
Wait time.
A lot of doctors' offices, you come in and it's going to take 2 hours for you to be seen.
That's horrible.
What are our wait times?
Yeah, so you know this because you work here. It's a great question, but you don't wait. Honestly, we schedule people on time. I typically see about 5, sometimes 10 patients a day, and usually that's in 1 hour or 30-minute increments. So if you have an appointment at 2 o'clock, I'm going to see you at 2 o'clock. If you have an appointment at 9 a.m., I'm going to see you at 9 a.m. Or you'll see Chris first. He'll get your vital signs, and I'll come in at 9:02.
We're going to always be here to greet you.
Yeah.
Always.
Yeah, we usually this is like our front desk area, and usually the doctors, will be sitting up here because we like to see our patients come in. We know who they are. We shake their hand. We have them come back. It's kind of like a different kind of type of atmosphere in our office.
It definitely is. It's like a family. You feel a sense of you're really being taken care of by someone who cares about you.
Yeah, and that was like the goal of our practice, is to provide that environment where people feel welcome, where we can develop trusting relationships between ourselves and our patients, and really take care of them to the best of our abilities. And part of that is having enough time to do it. So that's where the 30-minute to 1 hour appointments come in.
Awesome. Well, that concludes my questions.
Yeah.
Hopefully, I think I asked or covered everything anybody wants to know.
Yeah, and if you have any other questions, you can leave them in the comments, or you can send me an email, paul@plumhealthdpc.com, or you can send it to chris@plumhealthdpc.com. Really easy to get a hold of us. Thanks so much for watching, and have a great day.